Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
I'm one of those people who absolutely, I have wax in my ears, but I don't want anyone to touch it. But my favorite doctor is Dr. SINA JOORABCHI, and he is part of he's an ear, nose, throat, allergy, and facial plastic surgeon in Broward County. And so he's along there with Dr. Craig Shapiro, and I have been going there for a long time, and everyone laughs at me. What do you mean you drive down there just to get your ears cleaned? Because I know when he cleans my ears, it's going to be a good job. So thank you, Dr. JOORABCHI. I'm hearing better.
Well, I'm glad you're hearing better. When you start talking like that, it always puts a smile on my face. You get such positive, happy energy. I'm happy just to do a little thing as earwax cleaning to help you out. But it's always great to see you too, ANITA. That's for sure.
Well, one thing that your practice does, and it's grown so much. I know when I first met you all over there, I don't think you were even part of the practice, and it was going there for hearing aids and general ear, nose, throat, and then you joined. And boy, the practice has just jumped. It's going through the roof, and I know why. You have a great personality. You do a very good job. And then one thing that I'm amazed at, when I go and sit in your waiting room, you have people from all ages sitting there. Why is that?
Well, we all have ears, nose, and throats, right?
That's a good answer. Sure. Thank you.
We all have those organs, and that's actually why I chose this specialty, because I like kids, I like people my age, I like adults, I like the elderly, and I wanted that versatility. I didn't want to be, bottlenecked into one area, because we see a lot of kids with issues, even from, right after birth, hearing or tongue-tie or nasal congestion, right up to the elderly for hearing issues and balance, even sinus and allergy stuff. And, it's something that I really appreciate, because I can keep involved with everybody, and I think it's nice to have that variety, that mix of people. One of my favorite things is asking people who look the healthiest what their secret is. Oh, I forget this 95-year-old Asian man. He looked like he was probably 68. He looked fantastic. And I always ask him, and I always say, it's my spouse or it's my workout routine. And he flat out just said, I drink half a bottle of wine every night for the last 45 years. I'm like, well, there you go. That's what I got to start doing.
Is that what he said?
Yeah. So it's just great to deal with everybody.
Well, on a serious note, for people, though, who, and I know that you've been working in this field of vertigo and people who are having balance problems, and it's not something we ever thought of as an ear, nose, throat physician, but I know it's pretty serious, because one thing can lead to another. So when someone comes in to see you, do they tell you that they're dizzy, or do you do testing for them?
Yeah, so a lot of times we do get the referral because someone's having a long-standing balance issue or a vertigo issue. And, they may not know. They know they're having an issue. They may not know where it's coming from. Vertigo is probably one of the most difficult things I see, if not the most difficult, because it's very hard to describe. And many different systems are at hand as far as how to basically get yourself functioning in a balance set. Your heart has to be working well. Your thyroid's got to be working well. Things in the brain have to be firing. Your inner ear, your muscles, your thyroid, your adrenal glands. There's so many different things. So it's, oftentimes on the first stop, and, one of the most common areas is the inner ear. Is your balance system sensing the environment appropriately, or one area weaker than the other? So your balance system is like a jet propeller engine. It's constantly spinning, constantly firing. And imagine those jet propeller engines that got the two engines that are constantly spinning. And sometimes one of the systems starts spinning at a slower speed compared to the other. So if a jet did that or a plane did that,
are you there?
It would be out of whack. Yeah, I'm there. I'm here. So that's basically one of the first few things we look at is the inner ear working okay? But it's a very, very common common thing that we get that come into our practice.
So that's a little scary, though, because I know that people, especially the older adults, they may not realize this is happening, and then they fall, of course, and then there are all sorts of things that can happen, whether it's a broken hip or they bang themselves up. And is this preventable? Would they have, is it just happen one day and then they've lost their balance?
So that's a great question. It's preventable as long as you keep yourself healthy. It's easy as that said. But, there's, unfortunately, as we get older, things can change. And a lot of this is a nerve-related phenomenon. And unfortunately, as we get older, nerves start to die down. So, with nerves, it's a use it or lose it phenomenon. So the more physically active you are, the more exercise you do, the better those connections are maintained, the less likely you'll get dizzy. But again, like I said, vertigo is such a difficult thing. You could be working out like a champion and you have low blood pressure and get lightheaded. And that can definitely, that can throw it off, and that wasn't really preventable. So some things can be prevented, some things just happen. And that's what's so traumatic about it, is that it just rocks people's world. It comes out of nowhere, and even the healthiest Ironman athlete can come in because his heart's not beating fast enough, or someone that's had their diabetes controlled very well all of a sudden has a plummeting or skyrocketing sugar. So you really have to look at the whole person. And again, sometimes it's preventable, sometimes just hits you like a bag of rocks. And, thankfully, we're here to put out the fire for you.
Okay, that's something for people to know about. I've heard people say that when they get out of bed, they feel like they're dizzy and they're going to fall. Is that something different?
So that can be two things. One of the most common things is that, anyone that's sitting for more than 10 minutes gets pooling of blood into their legs. And we need the veins to basically pump that blood back into our central vascular system to be able to pump that blood back to our brain. And, as we get older, sometimes it's a little bit harder to do that. So even myself, if I'm sitting for a long period of time and I stand up, sometimes my blood's not pumping fast enough to the brain. I get lightheaded because of the lack of blood flow. And that's something that gets worse as we get older, as our veins get a little bit weaker. There's another phenomenon, though. Rolling out of bed could also be causing what's called benign positional vertigo, which is the most common cause of vertigo, one of the most common things we see here in our office. That's basically just having loose crystals in the ear, and that could just be sloshing those around and basically causing the sensation of movement when you're not supposed to be moving. So when people tell me they get out of bed and they get dizzy, it's most likely the blood flow thing. Next up is likely these crystals in the ear. Both of them are actually pretty well and easily treated. But if anyone's getting that out there, the first recommendation is to take your time. You get out of bed, you have both feet on the ground, you wait a minute, and then preferably when you stand up, you're by a wall, and you kind of hold before you take any steps. Give your body about 15 to 30 seconds to kind of acclimate, then take your first steps. Unfortunately, a lot of times in the middle of the night, you're not always thinking that way. You want to bolt to the bathroom, and that's when we usually see our issues. If patients come into the ER with gashes from falling, or they notice a vertigo at night because of recovery. But if you can just get in the habit of taking your time, getting your feet on the ground, standing up slowly, and then walking slowly, you should be able to prevent a lot of those issues from happening.
Excellent advice. And I just wanted to share this with everyone. If you are in need of, as far as I'm concerned, the best ear, nose, throat, allergy, and facial plastic surgeon, the whole organization between Dr. Craig Shapiro and Dr. Joorabchi, you really need to go to them. They're in Pembroke Pines, and I don't care where you live. This isn't like you're going to go to the grocery store where you want to be very close. I always want to find the very best physicians of a particular specialty, and I really believe that this office has that. So let me give you a phone number to make an appointment. If any of these things, as we're talking about them, that you say, yes, I need to go to a doctor for that, please give them a call and let them work their magic on you. It's 954-438 7171. Get your pencils out. Remember, I always refer to this as Pencil Talk Radio. It's 954-438-7171. And they are located. It's very easy to get to. It is on Pembroke. It's on Pines Boulevard in Pembroke Pines. Okay, so now let's cover a few more issues that you see. Now, I know you were at our Cure Symposium, and you did a whole thing on sinusitis. That's quite everyone seems to have sinus now. They don't have colds, they have sinus. Is that true?
Well, it's very common. I mean, if you put all the bad diseases out there, heart disease, diabetes, cholesterol, sinus can be responsible for the most frequent visits to your doctor, more than all of those combined. People are going to the office because they got sinus issues, nasal congestion, sinus pressure, and so it is definitely one of the most common things that I see. And so when I was at the symposium a few years back, there was something we were talking about which was relatively new. It was basically called the balloon sinuplasty, where if you think of plumbing, over a period of time, the drains will narrow, they'll clog up, and you get blockage of fluid, or basically like standing water as you would have the bathtub drain. And what the balloon does, it's kind of like a little wire that kind of fits into where the plug drain is, and it kind of pops open the drain and just lets that gush of fluid come out. And not only does it help in that moment, but it also helps in the long run. If you have a bigger drain, if you had a bigger shower drain, then it wouldn't clog up as much with debris or hair or all that stuff. So if you have a bigger sinus drain, the same idea is true. So this is something that we were doing a lot of in surgery, and the technology just got dramatically better to the point that now we're just doing it in the office setting. It literally takes me 10 minutes. It takes me 10 minutes to fix your sinuses, when before you had to put you to sleep. There'd be a recovery. There'd be, 1 week of issues afterwards. This is a hot procedure. A lot of us are doing it, and it's because it's working very, very well. Now, it's got to be in the right patient. And not everyone is a nail, and you don't only have a hammer. But in the right patient, it is a home run. And this is something I even told my patients. I do it to my wife if she needed it wholeheartedly. I think it works out well. And I've got my numbing down where patients don't feel a thing. I was at the dentist the other day, and I was looking at the guy. I'm like, do you know that I'm feeling this right now? It's good to go. It's good for the doctor to go to the doctor every once in a while to kind of get put in perspective that pain is not pleasant. Right. And I like that. I like being put in my place. But that's something I really pride myself in, is the experience. Are they comfortable? Is everything okay? Do they know what's happening? And I think it's pretty seamless now in our office. And I'm proud about that. I think that patients will definitely speak highly about their experience here. But back to the procedure, it is a very, very slick, easy, and straightforward thing to address these chronic headaches, nasal congestion, and sinus issues. So that was one of the things we were talking about.
Yeah, that's true. But I was going to then, we said something about having headaches. There's so many now, people I know that have migraines. Now, does sinus cause migraine headaches?
Anita, you get right to the controversial issues, don't you? You
Right.
get right to them.
Well,
so that's a very tricky issue. The reason is that a lot of people have headaches, and just a lot of people have vertigo. But you got to figure out what the cause is. So sometimes sinus can set off migraine. That is very true. The stress of sinus can definitely set off your migraine headache. And so we oftentimes see that, and it's our job to decide, is this patient purely migrainous, is it a little bit of sinus, or is it a hybrid of both? And oftentimes it is a hybrid. So oftentimes when we do treat the sinus, it doesn't get rid of all the migraine, but it certainly does help. It's one less stressor. I mean, with migraines, it's chocolate, poor sleep, stress, stress of infection. And if we're taking that away, it's one less trigger for someone to deal with. So I've had a lot of good success with patients, as long as they really do have some sinus issues. If they're purely just migrainous, then I send them to the best neurologist I know. Or sometimes a very basic treatment is to try vitamin B2, very harmless, 100 milligrams. you do get these migraine headaches. They can be very effective, especially for kids. But that is definitely a very controversial thing. We do see hybrid of both, but you have to be cognizant that sometimes it's just migraines.
And you said B as in boy, 2?
B as in boy. B as in boy, 2 as in 1, 2.
Right.
So 100 milligrams once a day, very safe thing. I've talked to a couple neurologists about this, and they stand behind it. They really feel that it's a good first step, along with, diet avoidance, avoiding your triggers, your caffeine, your chocolate, poor sleep, just healthy living. Generally speaking, you're better about your health, healthy living, and your medical conditions will improve.
Yeah. Okay, so we've covered that, which I thought really was important. Now let's go into the allergies and allergy testing. Are you all allergists, or why would someone go to an allergist rather than go to you for testing? How does that work?
So I do work with allergists closely, but we are an allergy specialty as well. You can't do ear, nose, and throat without knowing, treating, and seeing allergy. The only difference is that we can actually treat it medically and treat it surgically. The allergist can only really test you for allergies and treat it from a medical standpoint. Every once in a while, I do get them involved if they have some sort of immune deficiency or kind of unique condition. But for the most part, we're kind of a one-stop shop for allergy. Myself and Dr. Shapiro have done a lot of training in allergies, so we feel very well equipped. We've got all the latest and greatest technology as far as how to tease out allergies from a blood testing, molecular, or even traditional skin testing standpoint. And there's things that we can do in the office to alleviate allergies, little procedures to help reduce the congestion or reduce the surface area where allergies can hit inside the nose, your left leg to react to it. So we're pretty comprehensive in that regard to address the allergies, and, it is something we see a lot of because allergies also affect our ears, affect balance, it affects sinus. So it's a huge part of our practice, that's for sure. But I do have a good relationship with some of my allergists. They do help out, but they're usually for more esoteric, unique conditions that, require, more chronic management.
Well, do you have any allergies? I was just going to tell you about mine. Do you have any allergies?
I don't have. I've had a little bit of a cold right now, but I don't have any allergies, thankfully. But Florida, I get so many New York patients, and some of them come down here, and they're like, "I used to breathe just fine in New York. I come down here, and I just feel terrible down here." If you look at a map, we're in the beet red category when it comes to allergies. We are densely affected here. And so I'm lucky enough I don't have allergies, but it's very common here because the temperature never gets below 62 degrees. When that temperature drops, that's when all the pollens get killed off, and that's when, you're less likely to get reacted to the things that are in the air. The problem is, it's usually about, with the exception actually of 2 nights ago, we were just talking about that, it was in the 50s.
Right.
But 10 months out of the year, we're exposed to allergies. We don't really have a season. It's there, and then it gets more intense. So it is something that really hits us hard down here as being Floridian.
Okay, so I have an allergy to cats, not dogs, but birds and cats. So someone said, well, why don't you take medication for your allergy? And I say, well, I'd prefer not to. I just stay away from them. What do you think?
So really, it comes down to how you feel. I mean, first off, if you allergy test the whole U.S. population, 50% will test positive. But allergies is a quality of life measure, something that makes you happy.
Right.
So if you're happier with your sniffle but with your cat, then you're happy in the long run. But if you want to be with your cat, but your cat's just making you miserable, there are medications we can give you to kind of help you feel better. Number one, we can immunize you from your cat. We can teach your immune system how to deal with your cat's allergens so you no longer react to that cat. And I get that a lot.
Really?
One of my favorite things is that, I get a lot of patients that come in to have, I got this hypoallergenic dog, and I'm still having sinus pressure. And, you know, we have a favorite saying, if you ask your patient to get rid of Fido, they'll get rid of you. So
Right.
we're very sensitive of that. And but we do get a lot of that. A lot of people have pet reactivity. So there's a medication you can take that will prevent the release of allergen before you get exposed to the pet. You know, I would really advocate you keeping the pet out of the bedroom and the bed especially.
Right.
If you have a cat allergy. Cat dander can last up to 6 months. If you had a cat walk through a house and leave, it lasts 6 months. So you have to be really diligent about it, and you really wouldn't see a benefit until a couple months later to get the cat out of the bedroom. And ultimately, if you try all these measures, you give up, then we immunize you. We basically, you know, it's a process, but we teach your body's immune system how to better handle it, and that's one of the more common things we do. Now, one thing that's really changed is that not only are we, you know, we have the traditional shots, but we have something called SLIT. It's called sublingual immunotherapy. So the big problem with allergy shots, you have to go into the office and get a prick. So you go see a doctor and we poke you. I mean, how great is that, right? But now we have this thing where you can actually take the allergies home. You take the medication home. You drop it under the tongue, and it's a sweet little syrup. You sit for 2 minutes and you swallow it. And it's just like allergy shots. And so that's been wildly popular with kids. I've seen fantastic results in kids. Even a lot of the nurses bring me their sons in the hospital. I see them every day. They remind me every day. Thankfully, they're getting better. Otherwise, I'd be in trouble. But they're you know, seeing great results about this. And it really just comes down to compliance. You have to be consistent with allergy, whether it's a medication, so it's keeping a cat out, or it's immunizing yourself. Consistency is key with allergy. I can't stress that enough.
Right. Well, because I was always asthmatic, and the allergist, after testing, showed me that was one of the problems. And then I did take shots for 4 years. I gave them to myself. And
wow.
I know that. I mean, just so that I wasn't allergic to all those things anymore. But so everything you said is great. I wish I had at that time, because I don't have cats now, but I wish I had that very easy way to get rid of, you know, the allergy. Okay, we're going to keep moving along here. I know that you're involved in Botox and facial fillers. And, of course, we know that plastic surgeons and dermatologists do this. So what do you do there? I mean, do you like to do that?
Yeah, so that's what I have a board certification in facial plastic surgery, where we have a fellowship in allergy, board certification in ENT, board certification in facial plastics. So I'm kind of like a three-headed monster, if you will.
Yeah,
I have
right.
all these three things.
Amazing.
That I do. And facial plastics is a passion of mine. You know, I definitely enjoy doing Botox, facial fillers, specialize in rhinoplasty. But as I told you, I'm a guy that likes variety. So the fact that I can still see adults, I can still see kids, I can do allergy, I can treat cancer, but I can still make you look pretty, I think is a great, happy medium for me.
Yeah.
So I basically, you know, the more common thing I do, when someone comes in to see me, I don't give them my input. I tell them, I say, well, what bothers you the most? When you look in the mirror, what's the thing that bothers you the most? What thing catches your eye the most? And they give me their answer, and that's what we work on. So I find it extremely tacky for these plastic surgeons to pick apart people when they walk in the office, and they basically tell them what they should have done, what they shouldn't have done. So I'm in the confidence-boosting business. You know, try to boost your confidence, and fillers and Botox are one of the easiest ways of doing that. So the coolest thing about fillers is you can walk out with essentially a completely new look, and it's just amazing to see the transformation sometimes themselves.
Right.
You have to be careful too, because
Yeah.
sometimes people get really excited, and you start doing it, and they want more and more and
Yeah.
more,
Yeah.
and you have to pump the brakes for them.
Yeah.
That's when you see that, you know, Dr. 90210, overinflated lips, overinflated cheeks.
Yeah.
You have to have some responsibility to the patient to kind of say, okay, we got to do what's right for you, and we got to make sure that we're not going to let you be responsible with yourself. So I always tell them I got to protect you from you sometimes.
Right. I love the fact you're talking about this, because Yes, I have seen people who go back and back and back, and they start to look just like a monster, and they don't see that.
Right.
It's very sad.
I mean, Anita, you've been to our office. We're not hurting for business, so I don't need to be greedy. I turn people away if I don't feel like I can help them. And this is a major pet peeve of mine. You know, how can you do that to somebody, you know, and for gains of a profit? You should be there to help, whether it's cosmetic surgery, cancer, or allergies. That's what you need to be doing. And when people do that, it's really disappointing.
Yeah.
So I'd rather never be one of those surgeons. And if I am, then I'm hanging it up that day.
Yeah, I know that about you. I'm sure that's really true. So this has just been wonderful. I know I don't think we have time to talk more about the Botox, but Botox is really used for even more things. I've even heard people who have migraine headaches, they're now using Botox. We know that Botox is actually going, inside people vaginally because maybe they're leaking and there are all sorts of things. But we have to go now. But I just want you to know that we'll have to get you back and have to have a big discussion on Botox because I think it's kind of a miracle drug.
It is. And all those things you mentioned are great.
Yeah.
For the migraine, for voice,
right.
For the bladder, it's been fantastic. So,
right.
Yeah, I'd be happy to.
Okay, well, thank you so much, Dr. Joorabchi. It was wonderful seeing you the other day, getting my ears cleaned out, and having you on the radio show.
Absolutely. Always great to see you, Anita.
And I'm just going to give everybody your phone number one more time. It's 954-438-7171. Make an appointment. You'll be so happy. Okay, I'll talk to you again. Bye.